Hello, this is the 23rd of July. We are on the 15th day of our program on outpatient management of COVID-19. Today, I'm going to talk about investigations that you should not do in a patient being managed at home. You should not do the ferritin levels. Ferritin levels, normal range is up to 300, are useless if a patient is not being suspected of an impending cytokine storm, and such a patient will be already hypoxic and such a patient will not be at home. Similarly, IL-6, again an investigation for cytokine storm, and we should not do this investigation as a routine for home managed patient. Remember, ferritin is about 750 rupees in the lab where I admit, and about 3,000 rupees for IL-6. These are expensive investigations. Don't do them at home managed patients, for home managed patients. For the other investigation that we may avoid, one is LDH. LDH is a marker of inflammation, but we already have CRP, which is a better marker. So avoid LDH. I would avoid dengue and malarial parasite if my suspicion for COVID-19 is very strong. So please don't waste money on them unless you are really confused by the clinical picture. I would not do a full renal profile or a full liver function test in patients who do not have kidney or liver diseases, because you are adding to the expense. If I need, I will do creatinine. I might add uric acid in the renal profile, because if a patient is being put on favipiravir, I would like a baseline SGOT-PT, because some drugs raise the SGOT-PT. So maybe just that, but not the whole profiles. I would not do an X-ray chest in a patient who is being managed at home. An X-ray chest has very poor sensitivity or yield of detecting ground glass opacities. So don't do them. By doing an X-ray, you're also exposing a relative who will take the patient to the X-ray. You're exposing the patients waiting in the waiting room of the X-ray department and the technicians. So don't do an X-ray chest as a routine. Remember, you're adding to costs when you give a big list of investigations, and patients will do them because they are so scared. They'll do anything you ask them to do. But this is an expensive list of investigations if you include IL-6 and ferritin, etc. Well, the investigations that are mandatory in some populations are these. CBC, CRP and D-dimer must be done if a patient is above 60, whatever the comorbidities. CBC, CRP, D-dimer must be done in patients above 40 with comorbidities. CBC, CRP, D-dimer need not be done below the age of 60 if there are no comorbidities. I would not do any investigation of the blood variety. I'm not talking about the RT-PCR or the rapid antigen test or the HRCT for diagnosis of COVID. No, I'm not talking about that. I'm talking about patients in whom clinically suspected or confirmed COVID, what lab investigations you might avoid. Well, this is all about lab investigation in COVID, and we will take another topic next time. Thank you so much.